Of
Okay,
course.
Sanj. So, just before we start chatting with Dr. Sanjay Udoshi, Jean, you and Sue and I were just having such a robust conversation about COVID-19 and leadership and what our country needs right now. And I think that ties right into what Dr. Sanjay is going to be talking about. And I said, if you'd be so kind to share that with Sanjay at the beginning of our show, that would be awesome. We were talking about how we can get social issues involved on a day-to-day basis and speak about it on a
Oh,
platform
sure,
whenever
sure.
we can.
Sure. One of the things that's really become taboo in our nation is talking about politics, like places like workplace or religion, out and about. And I think we need to be talking about politics every day, everywhere, because for crying out loud, politics is what rules all of our food, clothing, and shelter. However, we've been taught, I would say, we've learned to separate the two, and we can't do that.
Yeah, life is politics.
It is. We have to.
And with that, we're going to open our show. So
Okay.
Sanjay, thank you so much for calling in. And I think you're calling in from Philly, right?
I'm calling just north of Philadelphia in northeastern Pennsylvania. So yes, I'm in Pennsylvania. That's my hometown, home city.
Yeah. So every time I think about Philadelphia, I think about a Philly cheesesteak. But of course, I don't eat beef, so I have to put chicken.
Yes, yes.
So thank you for taking the time for calling in. And I know you, like so many of us, we get so frustrated when we're watching the news or we're watching social media and reading what people are posting. And some of them are posting the most ignorant comments about COVID-19, wearing your mask, social distancing, washing your hands. And I know as a physician that bothers you, and me too. So tell our listeners a little bit about yourself, and then we want to chat with you a little bit about how we can move forward with healthcare, COVID-19, and what's happening.
Yes, thanks, Seeta. Thank you again for having me. My background is in population health, as well as clinical genomics and clinical decision support. So as a physician, my background has been in assisting large healthcare systems implement evidence-based medicine. And part of that is the evaluation of evidence-based medicine and its impact in the lives of people with chronic disease, as well as the monitoring of their behavior for positive effects of application of recommendations. So, this is where I come from in a epidemic or a pandemic as we are now. The evidence is evolving, right? So we've seen all kinds of information come forward to the public, and unfortunately, as you would see with other, chronic diseases, there's people who take the advice of their physicians and they tend to do better than those who don't take it.
Yeah.
So if you have a chronic disease like diabetes or kidney disease, chronic kidney disease, or COPD, or any of the other diseases that aren't necessarily life-threatening on a day-to-day basis, but you carry with you for a long period of time, the recommendations of your physician to get regular checkups and to get a particular blood work and make sure that you're taking care of yourself. Those who adopt those and take them seriously obviously always do better.
So what's stopping people from using common sense and science right now? I don't understand. It's to me, people have a common cold. They say, oh, I'm going to go see the doctor and get a Z-Pack. Well, the Z-Pack didn't fall from the sky. A scientist, physicians like yourself came up, with what Z-Pack does and how it helps the human body. So right now, they're not listening to the scientists about COVID-19.
You're absolutely correct in that assessment. So the problem is that we are facing a lot of public confusion. And I think that public confusion is driven largely by misinformation and the spreading of bad recommendations. And there's there's necessarily not exactly a specific person or anything that can be blamed. But we know that we are living in a very politicized, highly charged environment in this society this year. And we face a headwind of this tribalism that a certain side believes in the, in the leadership of one versus the other. And mask usage has become politicized. And we know that those who are wearing masks and abiding by the public health recommendation to distance themselves in public and not congregate are the ones that are at least risk from transmission and infectivity. So those who have adopted the stance that this is just some sort of hoax, or it is a political ploy by the opposite side to exert some sort of control over them, they are actually not just enhancing the risk for themselves, they're enhancing the risk for everyone around them, not just in their community, but also nationwide.
Right, and all they had to do was listen, but of course, I know my husband has a little app on his phone, and he can check that all the time and tell me how many deaths due to this COVID-19 pandemic. And I think right now we're at 192,000 deaths, and we have an estimated 475,000 long haulers. Explain to our listening audience on Viewpoint with Seeta and Friends, what are long haulers?
Long haulers, unfortunately, is a term used to describe a patient whose symptoms are lasting beyond the initial acute infection. So the initial acute infection is typified by a high fever, cough, difficulty in breathing. Many describe it as the worst flu they've ever had. The fever tends to last between 4 and 8 days on average, but for some, it has lasted much longer. But that's the acute phase. Now, long haulers are those who recover from that initial symptom of cough and difficulty breathing and fever, but now have some sort of a debilitating problem that they're dealing with as a result of COVID. And that could be something as serious as a heart problem, which we call cardiomyopathy, and that's a result of the virus damaging the heart. It could be damage to the architecture of the lung that has caused long-term breathing difficulties or long-term breathlessness. What I'm saying by long-term is about 3 months, 4 months, and in fact, a recovery period where they haven't felt well, they haven't recovered to their baseline.
So it's lingering. So it's just the disease is just lingering in their system.
Correct. And the issue with long haulers is that they need continued health care. So they are continuing to go back to their doctors and complain of these symptoms, and the doctors are continuing to investigate using, CT scans for their lungs and chest, and blood work, and following up by prescribing other medications that are trying to alleviate the symptoms. So you can imagine, with nearly 500,000 people seeking healthcare beyond the initial infection, this is also a burden on our healthcare system, as well as a significant expense to the economy.
Right. And we all watch on TV, people are talking about all these cures. If you take a combination of the Z-Pack plus, other pills, if you take vitamin C, if you take D, if you take zinc. As far as we know, there's no actual cure for COVID-19, correct?
That's correct. There is nothing that is available currently that is curative, either during the acute phase or after the acute phase, to clear the virus from your body. So, those that have gotten advice around hydroxychloroquine or zinc, certain supplements, who believe that these are curative, unfortunately, that's absolutely incorrect. And, this is the kind of pervasive bad information that we keep seeing spread through social media. And this is, dangerous. It is dangerous for many reasons, and the most obvious is the feeling that if they are taking these supplements, they don't need to use a mask. They don't need to distance physically. They can congregate in large groups. That's one aspect. They feel like they have some protection that isn't there. Or they just feel like if they do get sick, these are available as a cure, and they're not.
Right. But so Sanjay, so tell us, what is the impact of COVID-19 on our economy, the healthcare system in general, and actually to society? I mean, this is the cost that all of us, the taxpayers, have to absorb for those with irresponsible behavior. Like you say, if they'll go out and say, well, if I get it, I'll just go and ask for a Z-Pack and dexamethasone and some zinc, and I'll be all right for 2 weeks. But there has to be some detrimental cost to all of us with this.
Okay, so that's an excellent question. And I will start by saying I'm not an economist and I don't have a background in economics, but I do have a deep background in healthcare policy, policy impact around, the cost of healthcare and things like that. So speaking from that perspective, I can say that the length of this pandemic and its effect on the United States is significantly greater than in other countries. If you look at the curves, as we call them, of the increases in daily cases and then subsequent decreases, only the United States has seen this kind of case number on a daily basis for months. Other countries that were hit hard initially, like the United Kingdom, Italy, Spain, they have recovered from the high caseloads, and they have flattened their curve and now are in a phase where the daily case counts are much more manageable. Well, that does two things. That allows their healthcare system to reset and is not running at a maximal capacity for weeks and months at a time. We have to remember that the healthcare delivery is not mechanistic. It's not a bunch of machines running at high capacity 24 hours a day. These are human beings that are delivering care. And to ask your community of ER doctors and ICU doctors and nurses and the entire healthcare team in your community to run at capacity for weeks and months is not optimal, and it can lead to failure. And that failure means higher medical errors, greater unforeseen death rate associated with and not associated with COVID. And I mean, the statistics they tend to be very clear. So that's one aspect where you cannot overburden your healthcare system for this duration and expect the same level of performance out of it. Then, obviously, the inability for the economy and to recover to baseline means that less people are eating out, less people are shopping, less people are going on vacations, and obviously that's huge impact. So the length of the pandemic, as well as the daily high, transmission rates, the percent positivity above a certain percentage as deemed, dangerous or at high risk for large parts of the country, and that includes about 22 states right now, means that the economy is suffering. And when you compare our economy's GDP on a quarterly basis to other industrialized nations, we have taken the largest hit of around 10.6%, whereas other nations have taken half of that or less. And so the numbers tend to be very, very stark in comparison to the performance of other countries in dealing with the pandemic.
And so for our listeners or friends who are tuning into Viewpoint with Seeta and Friends, today we're speaking with Dr. Sanjay Udashi. I hope I'm saying your name correctly.
Correct, Seeta.
Good.
Udashi.
Udashi. I like it. Sounds like a movie star. So, of course, I've taken the flu vaccine every year for the last, I don't know, because I'm a nurse and we're required to take it at work. But, of course, a few people at where I work and my friends and all of us were saying, well, wait a minute. It seems like they're rushing this vaccine through for COVID-19. And people are really scared about the safety and the effectiveness of a vaccine that's rushed through. So, what can you tell our listeners on Viewpoint with Seeta and Friends to calm their nerves? Because a lot of people won't take it, or they're already dead set against it because they don't trust what's happening right now with it being rushed before the elections.
Sure. I think what I'll do with this question, as you were stating it, I think I'll offer a two-part answer. One is a compliment, and one is a caution. The compliment I want to offer is to the biomedical research community that's been able to characterize the virus, sequence its genome, develop clear pathways for understanding its infectivity, its life cycle, and potential areas where it can be addressed with medication that we currently have, as well as where we must look to develop medication that can be effective against it, all within a 6-month period. Now, I want to draw a contrast to what the same biomedical community did when it was faced with HIV. The same steps that I just described, characterizing the virus, sequencing its genome, looking at places where therapeutics can be applied, that took decades. And we've been able to do it in 6 months in this era because of all the tools that were developed during the fight against HIV. So a round of applause and perhaps even a standing ovation is appropriate for how hard the biomedical community has worked to address this globally, especially within the United States, because we are, we have the engineering and biomedical muscle to do this and to be the leader in the world in addressing it. So I'd like that compliment to go out to the public and let them understand how hard these people are working to get us out of the pandemic. The caution I have to offer is that the processes that I just described are assisted largely by automation, compute power, and manpower. But those same tools can't be used to develop a vaccine because the requisite steps are not automation-based. They are based on testing in human beings. So the processes of going through clinical trials, phase 1, 2, 3, challenge trials, phase 4, safety and effectiveness observations, they can't be rushed. The molecular biology, the manufacturing, the deployment, all of that is ready to go because of, like I mentioned, 2 decades worth of experience and tooling. So we have that at the ready. The bottleneck is observation in live patients. So, you can't shorten a 3-month observation period down to 3 weeks and expect the same results.
Yeah, so that's why people are scared. But Sanj, we only have I think 4 or 5 minutes left for this segment. But I wanted to ask you really quick. One of the questions that people ask all the time, and I received this on my email this morning too, was people are saying that less people are dying from COVID-19. Does that mean that the virus has weakened?
Great question. And from the studies of the virus and its mutation and the generation of different strains, again, the generation of strains is duration and population dependent. The larger the number of people who are infected, the more strains develop. And so the longer this goes on and the more people that get infected, the higher the danger of a strain emerging that is either more deadly or more infective and things like that. So that's why you want to bring pandemics to a close, to an end as fast as possible, while infecting as few people as possible.
Right, and the other thing is really quick. I see Paul's giving me 4 more minutes. Oh, we got 4 minutes. That's wonderful. So, what does the second wave look like? And should people actually be worried about the fall and the winter? I mean, you're a scientist. you also use good common sense, and I love how you explain things to us. You already have two fans, Sue and Jean, are both listening intently, and we love what you're saying. I mean, I wish I had more time, but so tell us, what do you think about the second wave, and should people be careful and be scared for what's happening?
Sure. So there's no cause for fear. I've said this on my last appearance on your show. There's no cause for it to be fearful. There's always a cause to be careful. So, and to finish up the previous question, has the virus weakened? Because that's important in answering the question you just asked.
Yeah.
The virus has not weakened. The virus is pretty much the same when it comes to its danger to your health. One thing that has improved is how we treat it. As you mentioned, and your background as a nurse, you're aware that the mortality, which is defined as patients that have been admitted to a hospital and then have confirmed COVID and go through the course of the disease. In the initial 3 months here in the United States, the mortality rate was around 2.5 to 2.7%. That means about 2.5% of people admitted with COVID would die. That mortality rate is now down closer to 0.5, so 0.5. That means we've seen about a 70 to 80% improvement in mortality rate. That means we've really cut down the risk of death if you're admitted with COVID, and that's because we have these drugs and the research behind them in the last 6 months about their efficacy in the hospital setting. But again, I want to repeat, this is in the hospital setting. Without medical care, we don't really know what the true mortality rate is. But with medical care, we are very confident that we've done the needful to bring the mortality rate down in hospitals. Okay, now back to the fall. One of the things to worry about in the fall is the fact that a lot of us, especially in the Northeast, are going to be, our activities mostly indoors again. During the summertime, we spend a lot of time outdoors. We spend a lot of time being able to walk around and get on our bicycles and be active outdoors. That may contribute to the fact that we've seen a much lower transmission rate here in the Northeast and in the colder states, so to speak, during the summer. As our activities return to the indoors, that's where the transmission risk is the highest. Recirculated air, inability to get circulation and fresh air promotes the viral transmission because it is an aerosolized virus. So as we start to gather for Thanksgiving and we start to shop for Christmas, and a lot of our activities return to the indoors, the risk for a second wave in the Northeast especially, and then subsequently later in the South, as the temperatures drop, is very significant. And so it's very important to remember that even though transmission and daily infection rates may start to seem, to the point of not being a threat anymore, they are.
Gotcha. Well, we have like 1 minute left. I'm going to give you 1 minute out of my second segment really quick.
Sorry.
What do we need to do to end this pandemic? And will another lockdown be necessary for it? People want it to go away, but I know it's not going away anytime soon. So what do we need to do?
Yeah. Excellent question. So in my estimation, I'll answer the last question first, which is another lockdown necessary? My answer is no, it is not necessary. And it would only be necessary if we see transmission rates exceed percent positivity of 25%, on average throughout the country, and in which case then we're headed for a massive second wave. So another lockdown is absolutely not necessary in this short term, in the next few months, I would say. But if Americans do not take this seriously, if we continue to see irresponsible behavior, then there is a possibility of this spiraling back out of control. Let's be very clear about that. What does it take to bring the pandemic to an end? Well, it's pretty simple, and I'm actually extremely hopeful about the fact that these paper-based, strip-based tests are going to become available at every drugstore, soon. So you can test at home, you can test your family and children regularly. In fact, that's recommended if they're going to go back to school, that they are tested regularly along with their teachers. If businesses are going to open again, then the employees that deal with a lot of customers should be tested regularly. So testing and the ubiquity of testing is one major tool that's coming out of this soon, as a significant way to reduce or eliminate transmission.
Well, Stan, thank you so much. Paul is giving me the heads up that it was a great segment. We really appreciate you taking the time to call in and give our listeners on Viewpoint with Seeta and Friends your website or a way to contact you if someone would like to, listen to you more or maybe hear one of your podcasts that you do. Just give us the information.
Thank you. So fb.com, Sanjay Udoshi, all lowercase.
Thank you so much again, and I'll talk to you later on, and thanks for calling in on Viewpoint with Seeta and Friends.
Thank you, Seeta. Take care.
All right.
Symphony Orchestra's Music at the Watering Hole, a free online family concert. The program will feature a stimulating original story by national best-selling author Michelle Wallace Campanelli that will come to life on screen with a film presentation created and directed by award-winning Mendex Studios. King of Africa, Kojo the lion, was surprised when a box fell off a tourist bus and dropped a symphony of musical instruments near his watering hole. With a great love for music, Kojo decides to bring all of the wild animals of the savannah together. Could these natural enemies learn to get along to become an orchestra? And just what would they play? The concert will feature music from Madagascar, Lion King, Zootopia, Jungle Book, Jurassic Park, The Croods, and more. So once again, that's Music at the Watering Hole, Sunday, November the 8th at 3 p.m. This is a Space Coast Symphony.org online event. Music at the Watering Hole, Sunday, November the 8th, 3 o'clock, Space Coast Symphony.org. When you need medical care and need it fast, MedFast Urgent Care is faster and less expensive than emergency rooms. MedFast is open 7 days a week, now with 8 locations serving Brevard County. So if you have an emergency, need a physical, or when your doctor is unavailable, with 8 locations, MedFast offers top quality care that is close by, and the number is easy to remember. That is 321-MEDFAST. You just call 321-MEDFAST. No one wants to wait in an emergency room for hours and get even sicker when you get the high bill. What you want is medical care fast. That's why you call MedFast, where most patients are seen and treated in less than an hour. MedFast Urgent Care opens 7 days a week with the convenience of 8 locations serving Brevard County. So when you need medical care fast, call 321-MEDFAST. MedFast. Located in Titusville, Florida, Dixie Crossroads has been serving great tasting seafood, char-grilled steaks, prime rib, chicken, fresh salads, and their famous corn fritters for over 31 years. The menu features the very best local shrimp and fish from Port Canaveral and ranges from low-cost sandwiches and baskets to high-end seafood combos. Visit this Florida favorite at 1475 Garden Street in Titusville. That's Dixie Crossroads, 321-268-5000, 321-268-5000, or visit them on the web at dixiecrossroads.com.
Welcome back, dear listeners. This is Seeta Biggie on Viewpoint with Seeta and Friends right here in Cocoa, Florida. We're on 94.7, 99.9, 100.7, and we're also heard on the air all over the world online at WWBC. All you have to do is put in WWBC. You'll see a little app there, hit on demand, and you're good to go. Correct? Did I say it right?
You said it right.
Yeah. Ellen Little is not here with us today, but I do want to thank Dr. Sanjay Udashi for calling in. I think he has two good fans here in the studio. I've never heard someone explain science the way he explains it, because he makes you fall in love with science.
Yeah.
You know, doesn't he?
Very clearly.
Because when I was a teenager in science class and they were trying to teach us stuff, I always wanted to do something different because I was bored. But the way he explains the genes and the science and what people are trying to do for COVID-19 and AIDS and the vaccines and all, it makes you want to listen and learn, right?
Exactly.
Yeah.